Good afternoon, respected Chairperson Sir and the Honorable Acquaintance present here. Today I am very happy to see that in this particular acquaintance session we have got the representative from everywhere. And especially I have the great respect to all my beloved brothers who always support me for the last 22 years. We have started this acquaintance journey. We have started this acquaintance Drishti Ratha Yatra. And this Drishti Ratha Yatra is mainly based on our acquaintance with our National Program for Control of Blindness and Visual Impairment with the help of so many NGOs and others. The premier of that is nobody else than the Lions Sight First program. I always like to remind you, see this emblem of acquaintance. At the middle of this emblem, there is this lotus. In our Hindu philanthropy, lotus is the symbol of eye, the Padma Lochan. And you see, below this lotus is the eye with the bright people. Everybody like to have a bright vision. And around this lotus, you see so many tents. And you see all these tents are the symbol of the community. But unfortunately, from all these tents, they have a look on the sky with a black moon, Amavasya, black moon. So we will have to show them the full moon, and that will be the real meaning of this lotus. So with this particular symbol, 22 years back, I have started my journey. My journey in Bihar was led by nobody else than my good friends, Dr. Sunil Singh, Dr. Sushil Rungta, Dr. Babu Saheb Jha, as well as so many others, and the great support of Bihar Ophthalmological Society. So also in Jharkhand, so many, our past president, B.N. Gupta Sahab, and everybody helped me. So also this morning I have got the privilege to have Dr. Shubhra Kinkar Goswami, the president of Assam Ophthalmological Society, who is the pioneer to have the journey of acquaintance in Assam. Being based in a very small municipal town of Nalbari, he has got the courage to organize the SARC Academy of Ophthalmology regional meeting, where he had got the proud privilege to enjoy the participation of more than 300 delegates from all the SARC countries. Hats off to him. We are very much fortunate to have him here this morning. Manoj Mathur, my dynamic friend from Telangana, he has also motivated and convinced so many acquaintances in Telangana and in southern India. Dr. Sanjay Daulat Thakur, a representative of Forum of Opthal Teachers of India, as well as an acquaintance, they are also with me. My young friend, Dr. Tripathi. Dr. Tripathi is the great son of Dr. Bimal Tripathi of Cuttack, Odisha. He has taken acquaintance movement in deep into Odisha, along with Dr. Ajay Singh and other people. With all of you, we are marching in Indian subcontinent. Today, I just like to show you my latest model, acquaintance Drishti Ratha Yatra, and how it acts. Very simply, my mantra is nothing other than our Swami Vivekananda's directive. Uttishtito, Jagrato, Prappo, Borannito. Awake, arise, attain. Then and then you will succeed. India is not at all a poor country. We have got everything. So many beautiful doctors are there. So many beautiful eye hospitals. So many beautiful research workers. So many beautiful medication. Only day before yesterday we have started Vande Bharat Express made up of India. So many beautiful intraocular lenses are being manufactured in India. In that way, we have everything. But unfortunately, in each and every Indian village, there are a couple of cataract patients who require surgery. In every third Indian village, there is one blind child who requires blind school education. But in government hospitals, 40% seats are lying vacant except winter for the lack of cataract surgery. In blind schools, miserable picture. Not more than 20% seats are full. 80% are vacant because of the lack of students, blind students. But blind children are begging on the streets. They don't know when to go, where to go, how to go, and who will accompany me. That's why it requires some awareness movement. Association of Community Ophthalmologists of India, established in 2000 for the 22 years, is working towards the goal of advocacy in community eye health in Indian subcontinent to make everybody aware about the existing eye health care facilities, where to go, how to go, when to go. So from Kashmir to Kanyakumari, from Ahmedabad to Aizawl, we are marching for the last 22 years in deep corners where nobody have gone, the Aquanians have gone. We had been even to Andaman and Nicobar. We had been to Myanmar border. We had been to the Chinese border. Everywhere we are there. In Arunachal Pradesh, in Tripura, everywhere in Nagaland, we are there in search. But now we have started a new journey. Now in all the 800 districts of India is covered in black and white with eye health care services. But unfortunately, all the people are not aware of that. So we have started a new journey, Drishti Ratha Yatra. It is nothing but a small tableau. We used to give this tableau, replica of this tableau as a gift to you. Please keep it on your table and every day remember that this Drishti Rath is there all over Indian subcontinent. You all know about Ratha Yatra, but Bihar, this Patna is very much important because of the interesting Ratha Yatra, what Lokoneta, Lokanayak Joy Prakash Narayanji has started in the year 1971. That was the first Ratha Yatra term by the name of some socio-political reason. Then in the year 1992, Lala Krishna Advaniji, he has started another Ratha Yatra by the name of some religion, Ram Yatra. But we have taken this Ratha Yatra by the name of Drishti Ratha Yatra. We used to go to the villages, we used to go to the schools, we used to go to the doctors with the message just to make the people aware of the existing eye health care facilities and how they can enjoy all these facilities, whether from government or from non-government. So far, my aim is to go to 1400 districts of Indian subcontinent within coming 4 years and to prepare in each and every district one community eye health care team. With this community eye health care team, there will be one chairperson, one captain, one coordinator. They will organize small community eye health care activities in his district around the year. But we are dreaming to have a National Community Eye Health Care Day from 2023. We will select that particular day and will approach His Excellency, the President of India, to declare that particular day all over the country. On that particular day, like polio, pulse polio day, all over the country, there will be observation of community eye health. On that particular day, in each and every district, we will host the flag of Aquan. We will make a small rally in our municipal or in district town. We will make some small screening camp, maybe for 20 or 30 diabetics, or for plus 40 population, 50 people in search of glaucoma, or 100 children to check up their vision. Very small program. And another small seminar for 1 hour over tea and some snacks. That's all. And we will discuss our community eye health team. In this particular way, someday after 5 years, you see, just like Pulse Polio Day, India will vibrate for the cause of Community Eye Health Day in one day. So keeping that goal in mind, we have started. We have started this journey from my own place, Midnapur, Tamluk, where the freedom movement was started. And in the year 1942, on 9th August, the first independent part of India was declared from that particular part, which was independent for more than a month. We have started this journey with Drishti Rath Yatra from that place, with the statue of Matangini Hajra, the martyr of freedom movement, keeping it back. And then we have started our journey all over Uttar Pradesh in 4 rounds we have been to Uttar Pradesh. And the Uttar Pradesh journey was started from Banaras Hindu University. His Professor Vishwanath and other was there. And we started our journey in Varanasi from Jaipur district, the district village which has been adopted by the Prime Minister. And we learned about Mirzapur. We went to Prayagraj. We went to Jaunpur. We went to Moradabad. We went to Pilibhit. We went to Bareilly. And we had been to Rampur. And we had been to Meerut. Then in 2021, we had been to Chhattisgarh. Right now, we are traveling in different parts of Chhattisgarh. Only a couple of weeks back, it was in Raigad. We had been to Mahasamundar district also. We had Drishti Rath Yatra in Rajasthan, in Jaipur district. We had Drishti Rath Yatra in Andaman and Nicobar in August 2022. We had Drishti Rath Yatra in the terrorist-affected Anantnag district, Jammu Kashmir in September. We are going everywhere. You can jolly well see in the villages of Jammu and Kashmir, we used to go and we used to chat with these village people keeping the apple orchard behind on the streets and others, and used to interact with them, like to check up their eyes in the health centers and other places. In this way, we are going on. Yesterday morning, I was in Boishali district. Yesterday afternoon, I was in the Akhand Jyoti Eye Hospital in Saran district. Day before yesterday, I was in Arwal district. And in the afternoon, I was Jahanabad district. One beautiful observation I like to tell you. There are more than 300 ophthalmologists in Patna, but there is only one ophthalmologist in Arwal district. There are only 2 ophthalmologists in Jahanabad district. In Punjab, I had been to Unreached district, Gurdaspur district and Jalandhar district. Here, there are around 16 districts in Punjab. Out of the 16 districts, there are only 12 government ophthalmologists in 12 district hospitals. All are vacant. But private sector, there are so many ophthalmologists. That's why it's a debatable question. And through this Bharat Darshan, we can come to know what is the community eye health scenario of India. And we have to find out how we can reach the unreached population, how we can make them aware of all these facts. We just like to highlight only 10 points during our Drishti Ratha Yatra to the common people. Everywhere, we used to have one motorcycle rally in the town. We like to prepare the team. We like to honor the team. Then we like to visit the higher secondary school, class 9, 10, 11, 12 students. Whatever my good friends are telling about this ASA worker and our government employees, about these eye healthcare activities, but this incentive in each and every step has destroyed the culture of human nature. What my good friend Dr. Sushil Rungta has told in one oration in my place in Bengal about a couple of years back, I always remember, what will you do with this big amount of money after your retirement, with your all your deposits and others? Why don't you think of some humanitarian activities in each and every day? The picture is same. Everybody is just looking after for some incentive or interest for any sort of activities you like to call them, for advocacy. That's why the best messengers are 9, 10, 11, 12 students I saw. So everywhere we like to take the advantage to talk before the 9, 10, 11, 12 students. Otherwise, we used to go to the village in the grassroots level, like to interact with them only with 10 message. Clear your eyes with pure, clean water. Because many places we have seen, they have got very least habit to clean the eyes with clear water. Second, what is proper food for the eye health? Many places, only rice and tomato is more than that. Only rice in Chhattisgarh I have seen, not so much vegetable even. Then, each and everybody should be taught very simply to examine their eye vision only by closing one eye. That will eventually drop the prevalence of amblyopia many times. Then in the schools, change the seats. Then for the diabetics, every 6 months eye checkup. Above the age of 40. And one interesting thing, right now, in each and every Indian village, by the virtue of the government, state government and government of India, blood sugar estimation is done. Almost in each village there is a beautiful list of diabetics, And all the diabetics used to get diabetic medication from the primary health center. But these medical graduates only, they've got least idea about the ocular complications of diabetes. That's why the diabetics in the villages used to take medication for diabetes, but have got no idea about diabetic eye checkup. That's why they must have to be oriented about the eye checkup every 6 months. So also, in each and everywhere, the health centers are equipped with some presbyopic glass correction. So every plus 40 are going to the health center for a pair of specs, but they don't have the facilities, or the ophthalmic assistant have got very little idea to check the intraocular pressure with simple Sears tonometer. But these are the very simple lessons which can help prevention of blindness in India. So also ROP screening, another lesson to be taught. So also immediate attention for any ocular injuries. What we observe that in schools or in household cases, following some injury, they like to hide for 4 or 5 days. Otherwise their parents or their family person will get angry. But delays they will do, there will be loss of vision every chance. So that should also be taught, report as early as possible. Eye donation movement is circulated everywhere, but facilities for eye collection is very much limited still now. That's why we have to promote the hospital corneal retrieval program as much as possible. At least if the people are motivated to donate their eyes who are died within the hospital, and if we can prepare our hospital to collect those eyes, that will be more than enough. That we will have to. And the last word is our blind school. I had been to almost all the blind schools in Bihar as well as in eastern India and northeastern India. More than 50 blind schools I have gone. But the miserable picture that not more than 30% seats are equipped. But you will be surprised to know, as per our national directory, hundreds students are there everywhere at least, and they are drawing a big amount of money from government of India as the subsidy for all those blind children. And another interesting, for a blind school in Bihar, they used to hire the blind children from 134 blind schools from Madhya Pradesh for 2 or 3 days for inspection purpose. So also the rivers from Madhya Pradesh, they used to take from Bihar or from Bengal and others. This is going on. So these things should be taught to the people, that the blind children or the blind person from any causes, they should be sent to a blind school, as well as for each and every blind nowadays, 1 lakh rupees is given from government as a non-refundable subsidy to start any project at his place. People have got no idea that we have to do. In these ways, this Ratha Yatra message will make the people enable about the existing healthcare facilities. And I would request all of you to support me as well as support the Aquanian to have Drishti Ratha Yatra in each and every of your village. I am very happy to say that this particular deliberation was heard by Mr. Nikhil Masurkar of Entoad Pharmaceuticals in my meeting in Aquan, Pahalgaon, the annual conference. Just after the meeting, he came to me, he said, Dr. Samanta, so long I will live, my company or my family will support this activity as much as possible. In this way, so many places we are going and they are supporting. So please make our awaj of community eye health to echo everywhere. As Kirtan in Govindaji temple of Imphal is going on for years together. So make our awaj of community eye health to echo everywhere and everywhere. And in that way, let the lamp to light lifelong for all those who have not yet got the light. As Gangarati at Rishikesh is going on for centuries together. Thank you very much. Join and Aquan Bilaspur 2023, 22nd, 23rd and 24th September.